Dr. Fong, sleep apnea. Lately it has been found out by the medical field that a tremendous amount of people have sleep apnea, which basically means they stop sleeping, they stop breathing throughout the night, and thus also sleeping. They don't get oxygen, sometimes for 10, 20, 50, 60, 100 times at night, and up to a minute long, which means they wake up exhausted and tired to a degree, or at least towards the afternoon, they almost get unconscious. In fact, there's more people apparently having car accidents, very severe car accidents, from sleep apnea than from drinking, drunk and drive drinking. It's quite something, and they just find that out now. A few months ago in New Jersey, a guy wrapped a bus around a ball with, I think he killed some people, and they suspect sleep apnea. Makes sense, because if you don't sleep at night and you don't even know it, this is happening. Now, most people who have sleep apnea also snore. Not all, but most. So when a person snores, there's a high chance that he also has sleep apnea. And I want you to shed some light on this whole thing and tell us about it. And tell us, where the heck does a dentist come in there to actually fix that? Because, I mean, you know, to feel energetic or not energetic throughout the day is a big, big problem. Never mind the car accidents. You know, I mean, even the lots less, like you get sluggish, so you start drinking Coca-Cola, coffee, and Red Bull type of drinks, but that's all a substitute compared to sleeping well. And of course, your thinking gets, you know, basically, you know, if a person doesn't sleep well, he doesn't think well, or at least not as well as he could. So shed some light on the whole story, please.
So in our normal interview and conversation with the patient, if they happen to mention to us that they're not feeling energetic and they're falling asleep in the afternoon, then in our interview process, we might determine if they truly are experiencing difficulty in sleeping at night or sleep apnea. And one of the things that we can take a look at is through our examination, if they have a very enlarged tongue or tonsils, that could very well be the signs of them experiencing sleep apnea. Because when we're asleep laying on our back, the tongue falls back. And when it falls back, it could basically kind of cover over their ability to breathe. And when that happens, they're not going to have a very good night's rest. And so there is an appliance that we can recommend to them that will help to reduce their ability to snore and reduce their ability for the tongue to fall back. And so when that occurs, then they'll be able to have a better night's sleep because we've been able to develop an appliance that will help to pull the tongue forward and the jaw forward. And so that reduces the chances of the tongue falling back and stopping their breathing.
So that appliance is kind of something that they wear at night, and I think it's a little bit like a mouth guard or something like that, almost like an Invisalign, like the orthodontic, the teenagers or the adults put on an Invisalign for straightening out their teeth. This one is similar than that. Is that type of mouth guard you're talking about?
Yes, that appliance would fit on your upper teeth and lower teeth, and there's like these bands that help to advance the jaw forward. So by advancing that jaw forward and the tongue, that helps to reduce that tongue from falling back and stopping the breathing.
Does the person also, because I've heard them calling, all kinds of things like silent night sleep and stuff, does the person then also have a tendency to snore a lot less?
Oh, they'll snore a lot less. Snoring was one of the factors that leads to the sleep apnea.
It was or it wasn't?
It does.
Okay. So basically, snoring somehow goes a little bit hand in hand with, if the sign of snoring is there, the chances of sleep apnea is relatively high.
It is increased. That is correct, Campbell.
Yeah, all right. Now, we know that sleep apnea gets also cured, or actually the golden standard is really a CPAP machine, which is basically a air compressor which presses air into your nose mouth with like a little mask, like the the pilots wear or something. Those fighters. Now that seems to be the real high standard, but at the same token, people have a hard time wearing it because it's uncomfortable. You need to lay there straight, and I mean, it's kind of, you're a little bit handicapped. But anyway, tell us about that and what you know about it.
Well, from my experience, what I've heard about CPAP is that you're right. They need to lay flat on their back, or especially for stomach sleepers, it's difficult for them to wear the CPAP. So the nice thing is that there's another option, and the other option is that snore guard, that appliance that they would wear that we had described and talked about a little bit earlier. But you're right. Most people with CPAP, they have to take the time to put it on, and if they're like most of us, we tend to fall asleep maybe on the couch watching television, or we're so tired that all we want to do is just lay down and go to sleep. And if they are needing to wear the CPAP, it's going to take them some prep time of putting that mask on, turning on the machine, and getting everything ready. By the time you do that, you're not going to want to sleep at that time. So that is the gold standard, because that will help to reduce sleep apnea. But having a sleep apnea appliance that's made in the dental office is just another option that the patient has in order to try to correct the problems and conditions that they're experiencing.
Well, it looks like that even if something is a lot better, if you manage to do it, fine. But if for some reason you cannot or don't want to do that better thing, then the next best thing is probably a lot better, because at least you do that one.
At least you're doing it right.
Exercise. Any exercise is better than no exercise, right?
That's correct. Yes.
Right. And also probably when a person travels or so, to carry that machine around must be much more inconvenient than having a little mouth guard in the pocket, with your toiletry. Now,
well, I think actually the reality is almost that no one's going to carry that. No one's going to carry that heavy equipment. So if they had something that was secondary that will help to reduce that sleep apnea and enable them to sleep at night, then I think by all means they should consider that option.
Right. Well, the key to here is, I guess, if you're snoring, which if you have a spouse, you probably know about it. And if you do feel a little sluggish here and there in the afternoon, or even when you wake up, the chances is you should go and see whether you have sleep apnea, get that mouth guard, because even if you for some reason still don't have sleep apnea and there are other factors why you're sluggish, well, at least you snore less, and that should be gold to your spouse. I heard, tell me whether it's true, with sleep apnea, like wearing an appliance, be it the dental appliance, the mouth guard, or be it the CPAP machine. It's a little bit like with glasses. It's if you need reading glasses, like I do, if you don't have them on, you don't see. If you have them on, you see. Right. And apparently, with this thing, with the sleep apnea, it's the same. If you wear an appliance, you're fine next day. You see instant result. If you don't, you don't. Not like with vitamin or good food. You can build up. And then once you build up, a few days or a week not taking them doesn't affect you very much, because you build up. In this case, that's not the case. Is that true?
The case is that it's important that the person be proactive. I mean, if they're experiencing difficulties in sleeping, then they should seek the advice of a professional, health professional. And that can start with just simply talking to your dentist, going in and mentioning to them, because if they have knowledge of that, they'll be able to discuss what is going on and what your options are. And then certainly seek a medical professional advice as well. The combination of those two will hopefully get you the needed rest that you need to enable you to function properly throughout the day.
Right. Because that's really where the key comes in. I mean, we want to be alive. It's not all about living longer and adding years to our life, which is fine, and we like that. But more importantly, I think we want to add life to our years, basically, while we're out there. I mean, there's nothing worse than in business life, in social life, to be basically tired and worn out. I mean, it's a drag, not just on the one person being tired, it's also a drag on the other people. Because you get cranky, you get lifeless. You don't want to participate in communications, socially or business-like, when you're a little bit dragged out. And that's really, it's a wonderful thing that the doctors found out that many people have it. Because how many people who don't snore? Not too many.
Yes, that's right. Not too many.
Like many people have it, and that's kind of like the discovery now. So, CPAP machine, yes. Dental appliance, yes. Both of them do the job. One is a lot cheaper, lots more comfortable than the other one. But as you said, go to a dentist, go to an MD, and find out what you should do, and also what can you do based on money and based on like your tolerance level. As you said, if you're a stomach sleeper, that machine might just simply not be something you will wear very often, yet the dental appliance you might. All right, Dr. Fong, thank you very much for telling us about sleep apnea and how it can be fixed. Apparently rather simple. Thank you very much.
You're welcome.